I would call on our last speaker, Dr. Rupal Shah, who's actually a pioneer in refractive surgery and has had a very major role in even the doing the study on the before introduction of SMILE, and she's the right person to tell us the way forward from SMILE to SMILE Pro. On to you.
Is this on? Okay. Thank you, Dr. Chitra, for the invitation to be here. And I will be very brief. I know the next session people are already here. I'm just going to give you a first-hand account of the development of SMILE and where in future it is headed to. I'm a consultant for Carl Zeiss Meditech, and I'm happy to say that I could be an integral part of development of this particular procedure. So the whole story started in 2006 when Professor Secundo and Dr. Bloom did the first lenticular extraction procedure in Germany. And in 2008, after the publication of 250 eyes, we took the baton and tried to solve whatever was unsolved to get it to the level at which it is today. In 2010, the first commercial sales occurred, and within 8 years, they had 1 million procedures performed across the world. And just recently, Zeiss celebrated 10 million SMILE procedures done all across the world, which is a great feat. It means that this particular procedure is here to stay, and it has stood the test of time. The initial problem was of only delayed recovery. In our first few eyes also, we were extremely surprised by the accuracy of the results. And at 1 year, more than 95% of our first eyes were within plus or minus 0.5 diopter. We were also surprised by the surgical ease and lack of corneal edema and haze. Of course, since there was no one in the world who had performed single incision SMILE before, we needed to even design the instruments to perform it. However, we also noticed a long visual recovery period, and that is what we tried to answer. We tried a lot of things. We tried steroid in one eye and no steroid in the other on table. We tried putting a BCL in one and not in the other. We even tried doing a PTK on the bed while we were doing flex procedures and not on the other eye, and yet there was no solution in sight. And, but somehow the solution came into our vision, and we felt that there were some cases which were going to do well the next day. So we went back and looked at those particular videos, and we found that if there were no accumulation of bubble in the center after the first pass, before the second pass would start, then the patients did pretty well. So while there was a different changing scanning pattern, where we were scanning the first pass, which was more posterior from inside out, followed by a side cut, and the second pass would come from outside in, and by the time it would reach the center would have a lot of accumulation of bubbles, as you can see here. So it would go through a very distorted cornea. And therefore, it would, when you remove the lenticule, it was leading to an anterior surface which was very distorted, which was also seen in the topography and in the way of the way in which the patient's eyes behaved. Over a period of time, epithelium would then smoothen out these, and then we would have not an issue, and the patients would regain the vision. We suggested this scanning pattern where we would go in the first pass from outside in, and in the second pass quickly from inside out, and this made a big difference. So even though it was a 200 kilohertz, simply changing the scanning pattern made a eureka moment. So when there were only 65% unchanged or gained vision at 1 week, it immediately went to 83%. And at 6 months, from 94 to 98% had unchanged or gained vision. And this laid the foundation stone for further developments. In simply increasing the frequency from 200 kilohertz to 500 kilohertz meant that everything was going to go on much faster, so the bubbles would not have a chance to really accumulate. There was increase in the spot spacing, improvement in the laser spot quality, And as a result of these interventions, SMILE today is equivalent or sometimes even better to femtoLASIK. And in our practice, just like in many more practices, more than 97% of our eyes reach best corrected vision within 1 day post-op. This is a standard technique. I'm sure you must have watched it. So there is one incision. It can vary from 2 to 4 millimeters. It's very easy now to find the planes. And once you have found the plane, and it's very easy to separate it out because the spot spacing and the energy parameters are very well adjusted. So you just go in with a blunt instrument and make a pass to break all the bubbles, bridge between the bubbles. This is the anterior portion getting separated, now the posterior portion getting separated. And once you have a free lenticule inside, you can just grasp it at the edge and remove it through that small incision, leaving the cornea smiling back at you. Getting all the remarkable aspects of SMILE were the predictability, accuracy, and stability of the treatment, which has not really changed. And more than 98% of all eyes are within plus or minus 0.5 diopters of intended correction today. So the current focus is on increasing the surgical ease while maintaining the speed of visual recovery. And the ultimate idea is to have a free-floating lenticule which can simply be pulled out of the stromal pocket. But creating a free-floating lenticule requires tighter spot spacing, and more spots would mean more time, and therefore requires a higher frequency laser to maintain or reduce the time for completing the procedure. Therein comes the role of Visumax 800, which has, as many of its other features, a 4-time higher frequency. And along with that, it also has an easy cyclotorsion alignment as well as central line system for easy centration. This has led to the procedure getting done within 9 seconds. So chances of suction losses are much less. And there is also a potential for easy lenticule dissection. Improved centration is a very important aspect because it is a refractive lenticule that you are creating. So if you have a good centration, it means that you are going to have a good result. And you can also now have centration over the visual axis. And cyclotorsion compensation helps in these higher cylindrical error treatments to get a very good final outcome. So we can look forward to a happier world with SMILE Pro. SMILE Pro enhances visual outcomes for the patients, increases satisfaction leading to happier individuals, a clearer vision improving quality of life, and more individuals experiencing the joy of spectacle-free sight. And that's where the lenticule extraction procedures are headed today. Thank you very much.
Thank you, Dr. Rupal, for your very nice presentation.